Good evening. My name is Joseph Banno. I'm the Director of Men's Health here at Midwest Urology. We'll talk about the disease itself, the causes, the various treatment options, and lastly, we'll get into the penile implant. Erectile dysfunction. This is the inability to maintain or obtain an erection suitable for satisfactory sexual activity. Now, this came out through the International Society of Erectile Function, and this is where I did my training at. Interestingly enough, I was at St. Francis for my surgery residency, and that's the first time I was exposed to a penile implant. There was a urologist, Charles Stovall, who was really one of the first in the nation to perform this type of surgery. He actually worked with Brantley Scott. And then when I was at the University of Chicago, my chairman, Dr. Harry Schoenberg, his special expertise was erectile dysfunction. And I came back to Peoria, and it's been my special passion ever since coming back to Peoria in 1980. Approximately 1 in 5 Americans over the age of 20 have this disease, either mild, moderate, or severe. 30 to 40 million men have erectile dysfunction. Back when I started, I could never get a group of individuals. Many of my people came from Springfield or Chicago or Joliet, and they wanted to pay cash and nothing asked. But now we know this is a disease. When I was in my residency, we thought that ED was psychological. 90% was psychological and 10% was organic. Now it's just the reverse. We know that most ED has an organic basis. However, I think every case there's a psychological component to it. So what are the causes of erectile dysfunction? Vascular and diabetes make up the vast majority of patients that I see with erectile dysfunction. Medication, anyone who has high blood pressure. I say the high blood pressure and the medications can be a source of erectile dysfunction. Pelvic surgery, anybody who's had treatment for prostate cancer, whether it be radiation, cryotherapy, open surgery, robotic surgery, laparoscopic surgery, pelvic surgery such as abdominal perineal resection for low colon cancers. All of this can cause erectile dysfunction. Endocrine problems, meaning low thyroid, hypogonadism, which we call low T, can be a source of erectile dysfunction. Other problems that we see, I see a lot of Peyronie's disease. Peyronie's is the curvature of the penis where scar tissue develops for reasons sometimes we really don't know. Sometimes it's caused by micro traumas that occur over the years. Sometimes smoking is the culprit. Treatment options that we have many treatment options. Prior to March 28th, 1998, we really were limited, but that was the advent of Viagra. So oral prescription medications, they're effective for, I'll say this, I don't think it's 70 to 80% of the cases, more like overall around 65%. It works in response to stimulation. You need to physically stimulate your penis, either by you or your partner. Just taking a Viagra and sitting, watching a football game, it's not going to make the erection grow. Usually we take 1 hour before sexual activity. It works for 8 hours if it's Viagra, Levitra, or Stendra, and up to 36 hours if it's Cialis. You can't take it more than once a day. Some oral medications are affected by food and alcohol. Viagra is notorious. You have to take it on an empty stomach. So if you're going out to dinner, let's say you're going to have dinner at 7 o'clock, then I say take it at 6 o'clock, an hour before, to let it absorb into the body. Headache, fascial stuffy nose, upset stomach, dizziness, these are all possible side effects. They're usually mild. If you carry nitroglycerin with you, you cannot take any of these medications. If you take it on a regular basis, you cannot. If you carry it with you for chest pain, you cannot. It's contraindicated. And that's really all that I'm going to say about the oral medications. Erection device. This is non-invasive. It's drug-free. It's cost-effective. The side effects are penile pain, numbness, delayed ejaculation. The erection is really not warm. It's very cold. I don't use it so much as a treatment, but as an exercise tool in preparation for surgery. It works very well. It's also used as an exercise tool in preparation if somebody is newly diagnosed with diabetes or newly diagnosed with high blood pressure, and they're just showing the early signs of ED. This is a great tool for them because controlling the blood pressure and diabetes and quit smoking early, along with the vacuum pump, can bring about success. We also have Alfostadil, which is called Muse, which you can see that it's a pellet that's inserted into the penis. No needles or injections. It has to be refrigerated. It has pain within the urethra and burning. Once in a while there's bleeding or spotting. It can cause low blood pressure, which we call hypotension, and dizziness. Intracavernous injection, it goes by many different names: Edex, Caverjet, Alfostadil, prostaglandin E1. This is really the only FDA-approved medication we have for injection therapy. I was using Trimix at times, but it's really not an FDA-approved medication, so I no longer prescribe it. The onset of the erection occurs within 5 to 20 minutes. Every time you want to have an erection, you have to inject yourself. The problem with this: pain at the injection site, a throbbing of the penis, prolonged erection. This is what the drug companies talk about, priapism, that can occur with the use of this medication. I have never, ever seen priapism occur with Viagra, Levitra, Cialis, Stendra. It just doesn't occur. It's one of the theoretical side effects. With this medication, it can occur. If the erection lasts longer than 4 hours, it becomes a surgical emergency. It causes scar tissue in 10 to 15% of the people, and you can develop a hematoma. Before I get into penile implants, I do want to tell you that there's a new treatment option out there that I'm going to start using, and this is called protein-rich plasma. It's probably the first forerunner to stem cell therapy. It's really not for everybody. It's for most cases with mild erectile dysfunction, where the medications have worked at times but no longer work. PRP, protein-rich plasma, can be an alternative. I don't have any slides with me now, but I will in the weeks to come. Suffice it to say, I think the bad thing about protein-rich plasma, you might look it up under Priapus shot, Priapus. It's not approved by the FDA. It's out-of-pocket expense. It's costly, and it may not work. Having said that, it does help people. If the right cases are chosen, 70% success rate. So now we get to penile implants, which provides an option for people, and it's a guaranteed erection every time you want to use it. You can use it twice a day, 3 times a day, 4 times a day. There's no limit to how long you can use it. It's been in the market for really over 50 years. There's been over 500 implants to date and a very high patient partner satisfaction. 92% of women would recommend it to another couple. 93% of men are satisfied with their result. If you look in the literature, there's several types. There's a 2-piece, a 3-piece, a semi-rigid. I only place the inflatable because I think it just gives the best erection. So the semi-rigid ones I just don't place. This minimal invasive procedure, there's a 2-inch incision that's made at the base of the penis. The pump is placed in the scrotum. The cylinders are placed within the corpora and the reservoir usually above the bladder. That minimal invasive procedure takes 15 to 20 minutes. It's very effective. People are using the device 2 to 4 weeks after surgery. It's entirely contained within the body. So if you wanted to go to a gym and you were working out and you were taking showers with a group of men, nobody would know you had it. It's totally concealable. Nothing is visible. It's inflated to provide rigidity and deflated for concealment. You can maintain your erection as long as desired. Unlike the vacuum pump, you've really got about 30 minutes that you can keep it on. With this one, if you wanted to keep it inflated for an hour or 2, that's fine. It expands in girth, and with the LGX, it expands in length. And one thing I think we should all know right now, I measure each and every patient at the time of surgery. I think patients' biggest complaint is this device isn't like I was when I was 20 years old. No, and I never said it was. If you've had Peyronie's disease, if you've had some scarring, there will be some shortening. If you've had a radical prostatectomy, there is some shrinkage. That's where the vacuum pump comes in. Men who have used the vacuum pump 4 to 6 weeks before surgery gain about 5.5 centimeters in length as compared to a group of men who did not use it. So the pump really helps out a lot. It provides the ability to have an erection anytime you choose. Press the button, it goes up. Press another button, it goes down. It's spontaneous, and once activated, you can have the erection. In one study of 112 patients and 91 partners, 80% of partners reported the inflatable penile implant felt natural during intercourse. Most patients tell me after 3 months, they no longer feel that it's a foreign body to them. It feels very natural. Typically, it does not interfere with ejaculation or orgasm. So if you're able to ejaculate before surgery, you'll be able to ejaculate after surgery. If you're able to have an orgasm before surgery, you'll be able to have an orgasm after surgery. We don't deal with the sympathetic nervous system. We're down low where the parasympathetic nerves are innervated. Possible risk. There's risk with everything. I think infection is the big one that we worry about. Implants, with breast implants, with hip replacement, with knee replacements. In the last 10 years, I've had 3 infections. And that's pretty good result. Nationally, 2 to 4% of infections occur in patients. My results are much lower. 98% of my implants are done right next door here at the surgery center, so you don't have to go to the hospital. Why do I do that? For the number one reason, it's a more sterile environment. There's less pathogens that are floating around in the air. My team is the same team every time. They know just what I do. That's why we can go through a minimal invasive procedure in 15 minutes. There's a direct correlation between the length of the procedure and the source of infection. Longer operating time, more chance for infection. And I think that Tracy will tell you that she's been involved in cases where they've taken 4, 5, 6, 7 hours. Mechanical failures, It's a mechanical device. There can be failures. I had a patient this week that I implanted 17 years ago. And you know what? He was ready. He says, it broke, I want a new one. He got a new one, he got a longer one. Usually that's the benefit of after a malfunction, usually the tissue is sufficiently stretched that when you put a new implant in, it can be longer. Pain, everyone's different. I'd be on a morphine drip if I had one done. Other people, they walk around like nothing happened to them. That's why I say it's different. Some people use the device within a week. Usually 2 to 4 weeks is the average time. Some people are out to 6 weeks. This is a biggie, insurance coverage. As of today, 2015, Medicare pays for this. I don't know what's going to happen in 2016, but the year started. There's no problem. Blue Cross Blue Shield, Caterpillar, they're usually paying for them. I think overall, what's the percentage, Tracy? 90% of insurance companies pay for this. We pre-certify every single patient so you know what portion of the bill you're paying. And this is an important question. People want to know. You know, if you go to the hospital, that's the second reason that I don't go to the hospital. This becomes a $40,000 procedure, sometimes even more. If you were a cash-paying patient and you came to the surgery center, it would be $16,000 roughly. So that becomes important, especially if you have a copay. So you'll know by the time before you have surgery what your portion of the bill is. Right? We don't guarantee coverage for everybody. It's your responsibility, but it's our responsibility to see if your insurance does cover or doesn't cover it. Sometimes they don't cover it, and we can write a letter, and sometimes AMS helps us write the letter to give to the insurance company, and sometimes it's overturned. So with that,